So lower back issues tend to have a few common causes and related problems that go along with them. Most of it is to do with poor posture habits, especially for prolonged amounts of time. So if you tend to be sat at a desk all day for your office job, or you sit down a lot at home as well watching your TV, you tend to spend a lot of time in a flex spine position, which is like a C shape. So if you look side on, you tend to be kind of like that. What that tends to do is it tends to reinforce weakness, and it also tightens up your hips as well, which all contribute to putting a lot of pressure on your lower back. So one of the things that Dr. Stuart McGill talks about is flexion capacity, and how that each person's back has a certain amount of capacity to be in this position or to go into that position and come out again. And once that capacity is used up, an injury is going to occur. So from my own experience, I know that if an injury occurs, if you're lucky, it's just going to be a muscular issue, so maybe a little bit of a muscular tear, or you've just pulled your lower back. If you're very unlucky, then you might do, or especially if it happens over a prolonged amount of time or a number of times, you might do a bit of disc damage as well, which is when you're in a little bit of serious trouble. So you've got to definitely become aware initially of good posture versus bad posture, and kind of the bad habits that tend to reinforce bad posture and put your lower back at risk of injury. So another key issue we need to look at as well is that when you're sat down all day and you tend to sit with that bad posture, just being sat down all day because your hips aren't moving, the muscles around your hips, so your hip flexors and your glutes particularly, tend to tighten up around your hips and stop you wanting to move and pivot from your hips properly. And when this happens, you tend to learn to use your back to try and compensate, which further exacerbates the problem down the line. So long term, one of the key issues is to improve hip mobility, which in the program we look at by using some trigger pointing and some mobility drills just to help restore kind of normal movement to your hips. Because if your hips are nice and flexible and mobile, there's a lot less strain on your lower back, and you're a lot less tempted to try and use your back all the time. But you're using up that flexion capacity to bend from it, you're more likely to bend from your hips and keep your spine nice and stable, which is what you want to do long term. So in there I've included a few really good exercises using a body spanner mini and also a foam roller, which is to help improve the mobility around your hips and take this strain off your lower back, and just give it time to rest and learn to do what it should do, which is just to help keep you supported rather than control your movement. Okay, so the next key issue, following on from your hip mobility, is learn to stabilise your back, so that when your hips are more mobile, you can move from your hips and keep everything else stabilised and stiff. So McGill refers to what he calls like stiffness. So if you can keep this nice and stiff, you can spare your lower back, use your hips the way they're designed to, obviously prevent injury long term and reduce pain. So one of the things we look at as well is to include exercises that help you learn to buttress your spine, make it nice and stiff up here, so that when you are using your hips, your back's nice and safe, it isn't going to become injured. So it's one of those things you need to learn to do long term, is kind of replace or relearn specific movement patterns that help reduce strain on the lower back, spare the lower back, and learn to use your hips properly. So if you can stabilise these muscles around here and around your back, that's going to help you learn those movements better and also keep the strain off your back. So all these issues, they come all together to help you build a more robust lower back, reduce problems, and obviously improve your lower back health long term.